Hi there, I'm Elise Denneny. I'm one of the doctors with Greater Knoxville Ear, Nose, and Throat. And wait a second. Oh, that's better. Today we're going to talk about COVID-19 and ear, nose, and throat disease. As you know, the COVID disease is caused by a virus. The virus is the SARS-CoV-2 virus. You know, the virus is not unlike a flu and a cold virus. That means we spread it easily between people by coughing, sneezing on counter surfaces. Somebody picks it up, then touches their mouth and nose. There's just one difference. This virus is really contagious, and it also can have deadly effects or long-lasting effects that impact your health in future years. If you get the COVID virus and we pass it to each other, it usually enters the nose and the throat area. Well, let's see. In otolaryngology, we focus on the ear, the nose, and the throat area. That is prime real estate for COVID-19 disease. As you know, the virus then will enter the nose, go through the throat, and cause a sore throat. From there, it can go down to the lungs, cause inflammation. Your lungs swell up with water, which makes it difficult to oxygenate. You get pneumonia. You can't get oxygen, you actually drown, and it's very hard, difficult to breathe. This is generally the most serious effect from the COVID-19 virus. Does COVID-19 generally have symptoms? Yes. So we look for fever, cough, shortness of breath, and sore throat. Those were the original symptoms, but we now know that COVID originally can present with different symptoms. These are symptoms of loss of smell and taste. If you present with loss of smell and taste, you could be having COVID. We also know now that getting treatment for loss of smell and taste can improve the chances of recovering your smell and taste. COVID can impact sinuses also, although it doesn't usually cause the classic constellation of symptoms that we see with sinus disease. Doesn't cause a lot of nasal congestion, nasal drainage, facial pain, headache, but it can be difficult to tell the difference between the two. If you have a viral illness, generally you'll have other symptoms like muscle aches, fatigue, nausea and vomiting, and diarrhea. Those are the symptoms more of a viral illness. If you present with any of those symptoms, I would recommend that you seek and call your primary care doctor, and we'll get you lined up to get a COVID test. The line of symptoms that present for COVID disease is getting longer every day. And COVID can cause an illness that is almost asymptomatic, very mild, to very severe and even death. Very difficult to tell or to know what's going to happen. So if you think you have any of those symptoms, call us, isolate yourself, socially distant from your loved ones and from other people, and wash your hands. We'll get you tested. If you need to come to the office, you will notice that in our office, we have taken every precaution necessary to prevent the transmission of the virus to you. Also, if we decide that it's necessary for you to have surgery, extra precautions have been put in place to make sure that you are safe during your surgical process. If you need to get a COVID test and you are on blood thinners, remind them at the testing site because some of them require that swabs pass through the nose. Remind them that you are on blood thinners and that your nose is very sensitive, and that way they'll be gentle and you'll not get a nosebleed from the episode. So let's see, what have we learned? We have learned about the virus. We have learned about the symptoms of the virus. We've learned about what to do if we think that we have the virus. The important thing is to stay healthy. We're here whether you need to visit with us in person or whether you need to visit with us by telemedicine or even by telephone. I want to thank you. I want to thank you for staying safe. I want to thank you for wearing masks. I want to thank you for your patience, for social distancing, and for washing your hands. The most important thing is to stay safe and healthy.